we can move on to the next history. 36-year-old male with history of IV drug abuse and multiple sexual partners. He comes to the OPD with complaints of yellowish discoloration of sclera. So it indicates the patient is having jaundice, passing of yellow colored urine, fatigue, low grade fever and pain in the right upper abdomen. On investigations, his serum bilirubin is, what is this value? Is it normal? 3.6 milligram per deciliter is the total bilirubin given for this patient. Oh, what is the normal? It is 0.2 to 1.2 milligram per deciliter. Normal total serum bilirubin is 0.2 to 1.2. Here the patient is having elevated serum bilirubin and then we have to find which serum bilirubin is raised, whether it is direct or indirect. Direct is conjugated and indirect is unconjugated. So direct bilirubin is raised in this patient, it is 2.4, whereas indirect is 1.2. So with this we infer that the patient is having conjugated hyperbilirubinemia. Now we will go to the other serum markers. Serum ALT is 70 international units per liter. What is the normal value? So alanine aminotransferase is usually 10 to 30. Okay. Aspartate aminotransferase, it's usually, again it is also less than 30 or 40. Serum alkaline phosphatase is also raised. So with this we have the patient with hyperbilirubinemia, which is conjugated type, with ALT, AST and serum alkaline phosphatase raised. Moving on to the viral serological profile, HBs antigen is present, HBe antigen is positive and HBV DNA is also positive. So what is the diagnosis? So if you are given a case with this history like this, what will be your diagnosis? So yes, I know you are all correct. The diagnosis is hepatitis B. So what is hepatitis B? It is also known as serum hepatitis. Of all the 5 types of hepatitis, hepatotropic viral infections we are going to see today, this one carries more significance because there is incidence is more common. And the carrier state is more common here with 300 million carriers around the world. And in Western statistics, in the US, 60,000 new cases of hepatitis B are encountered per year. And of this, 2 million people develop chronic HBV infection. This hepatitis B is also supposed to be endemic in African and the Southeast Asian countries. We'll move on to the clinical spectrum of hepatitis B virus. It can produce acute hepatitis followed by complete recovery and full clearance of the virus. So there may be some markers only which indicate that the patient has encountered hepatitis B infection. So it produces acute hepatitis with the symptoms but complete recovery and clearance. Or it can produce acute hepatic failure with massive liver necrosis. Or it can produce chronic non-progressive hepatitis. It will be as such chronic hepatitis. Or it can produce chronic progressive hepatitis which can lead on to cirrhosis. Or it can be like a asymptomatic healthy carrier state. So these are the clinical spectrum of